Hello, everybody. Thank you for taking the time to listen to this address, and I hope it's meaningful to you and gives you some information about the American Society of Acupuncturists. We're very proud of the development of the organization over the past 4 years, and we wanted to share with you the status of the organization, where we've been, where we're going, and how we sort of see the playing field for the profession right now. And we really need your involvement in that and your participation. Working together, we can really make for a strong force for the profession, advocating for us at all levels, but we definitely need to do that as a coordinated group. So the American Society of Acupuncturists was originally founded in 2015, and so we've been incorporated for 4 years now. As of March of 2019, we had 27 states represented by 28 state associations. Florida has 2 state associations participating, and these are the paid member associations. And those paid member associations represent between about 4,088 and 4,400 individuals. We were still waiting on current membership numbers from a couple of the states to get that exact count. We do have participation, however, from most of the country. So everywhere but the states in non-green colors are actively participating with the association. And a couple of the states that are not either don't have active associations or just haven't been involved with anyone particularly nationally as of yet. So we're really happy to see that we do have sort of boots on the ground, and as part of the conversation, pretty much all of the major leaders in all of the states who are actually doing legislative work in those state areas. We worked with groups like Kansas to help get them, give them support in their journey to get the Practice Act, and other states as well. And we do have applications pending for membership from a number of states within this group, including Arizona, the DC organization. We have some interest from Nebraska. Hopefully South Dakota and a couple of the others will be joining us as well in the near future. As a general roadmap, as you probably know, there's about 38,000, somewhere between 30 and 38,000 licensed acupuncturists total in the US. Of those, about 10,000 or more are in California. We are in touch with both of the groups in California who are the major membership groups there, so CCAOM and CalAtma. CalAtma, we believe, will be putting in an application for membership as well in the near future, and they will be attending our meeting. So we're trying to increase collaboration with the voices in California working to organize that state, and hopefully see those practitioners brought into a meaningful national presence in the next year to 2 years. But it does beg the point that it is important for all of us to be involved. We're not a large profession. We don't have sort of the leeway that the medical doctors have, or the physical therapists have, or the nurses have, to have only a small percentage of our practitioners be members of our political structure, our organization, really lobbying for the profession. With this number of people, we really need as many people involved as possible. As of 2018, acupuncturists were officially recognized as a professional group by the US government, and this sets the stage for a lot more involvement for the profession in general in governmental type agencies. It helps to define us, helps to be able to track us. So when we start talking about acupuncture for Medicaid, for example, this becomes a much more identifiable a conversation of much more identifiable group to be included than previous to this. Now they do have a definitive group to include potentially. We'll talk about Medicaid more in the near future. Or shortly in this talk. So the founding of the American Society of Acupuncturists, though, in 2015, I just want to give you some background on that. It was developed by experienced leaders in the field. The group that formed this was the leadership of the state associations, who really worked together, both with each other and with lawyers and with advisors, to create a structure that was sound, financially transparent, and that could function to represent us at all levels of the profession. We have tried to be as transparent as we can be. Our taxes are clean. All of our finances are completely transparent. We are a 501c6, which allows us to do lobbying as much as we want. We are a non-ethnically based structure, so all of our state member organizations must be open to any professional member within that state. We have remained as true to our bylaws as any organization can possibly be, so we feel comfortable that we're not in jeopardy of bylaws violations, which can be a big issue for not-for-profit organizations. We have good governance and turnover and leadership. We have established term terms for all of our leaders. So I will be terming out in just under 2 years as the chair, and we'll move into the immediate past chair position. We will be looking to have somebody else move into the chair position, et cetera. But we really believe that that good turnover and good governance is part of the core of a healthy organization. And so we are working to make that happen. We have a strong collaborative commitment. That's part of our philosophy. So we'll talk about that shortly as well. And we do have representation at the state, national, and international levels. And so we really consider ourselves to be a grassroots organization, but with a structure that allows us to have reach at all of the necessary levels. We also have really been trying to recruit talent. So as we bring people onto our committees, as we bring people onto our boards, we're looking for people with documented leadership experience or expertise in business, perhaps, in advertising, marketing, and things like that, that can bring those skill sets into our profession and have a platform from which to work so that they can leverage that for the benefit of all of our licensees. So we think that is a really a strong point of the structure. We have a strong nominating committee and vetting committee. So everyone goes through proper process, and we review their CVs and references and interview them and really know who they are and what their interests are. I myself have been studying professional associations now as somewhat of a hobby for a number of years, and so I've been involved with the Illinois State Med Society, National Physicians Alliance, the AMA, particularly doing the work with the CPT Committee, the Academy of Pediatrics, and others, as well as numerous Eastern medicine associations like the Illinois State Association, and also the American Academy of Medical Acupuncture, which is the medical doctors practicing acupuncture as well. I've been involved with the National Certification Commission, NCCAOM, for many years too, and in the educational world as well. So just as an example of trying to bring all of that experience together to create an organization that's able to function within our professional system has been a personal goal, as well as a similar goal shared by other leaders within the organization. So we tried to bring that expertise together to create an organization that was appropriately structured for Western medical engagement, so that we can walk into the arenas where these other organizations are presenting and be recognizable, understandable, and respected and recognized as a player in the American healthcare system. And we think that's a real strength to the organization, and will allow us to lobby for the professional base better than perhaps we've been able to previously. We've been collaborating with lots of different groups. So the Integrative Health Policy Consortium was one of our newest collaborations. I'm sitting on the board as a representative ASA to that organization. We are in very close contact and collaboration with a number of the Chinese groups, the ATCMA and APAS. We have worked with the Society for Acupuncture Research. We've had a lot of really positive interactions with the European TCM Association as well too. That's a really interesting group that's structured very similarly to the ASA, only their state association members are actually different countries. So we have some challenges, but they have bigger challenges. But they've been wonderful to work with as well too. And have really had a lot of outreach to all the different sort of sectors of the field and trying to connect with all the major players nationally and internationally and create that collaborative base. We represented the United States at World Acupuncture Day in Paris back in November of 2018, where we got to represent for the United States and educate the world on what's going on in the US. And I think we sometimes lose track of the fact that the US is actually really a leader in the development of the acupuncture professional group. Very few other places around the world outside of Asia do you see the infrastructure development that we have in the United States. And I think that's something we need to be really proud of and also really protective of, that we continue to develop that. And, just to underscore that ASA was really developed with the intent of working collaboratively with all of the major players in our profession, particularly ACOM, CCAOM, and NCCAOM. We really see those as the organ systems of the profession, and that we all need to be working together collaboratively in order to create a strong, unified field that really can move forward into American healthcare. We've also been working with the folks in the Veterans Affairs, Department of Veterans Affairs, who've really been instrumental in getting licensed acupuncturists into those systems, and also have been working as we can with the Department of Defense and trying to help promote licensed acupuncturists within that system, including, to the degree that it's possible, helping to correct the downgrading of LACs from a GS-12 level to a GS-8 level, which is really from a professional level down to a technician level, that was done before we were able to get involved. And has been really problematic, I think, for the profession within the DoD, and we're trying to work on fixing that if at all possible. We've been the primary representation for the profession in the CPT code process now for a number of years, and we're instrumental in helping to avoid a real train wreck in terms of CPT coding surrounding dry needling. So I feel like our presence there was really, really meaningful and important, but that is an expensive project to be involved in, and represents one of the reasons we need full collaboration, because we just can't afford to maintain that type of involvement without a base of support to do so financially. All of the members of the ASA, all of the board, everybody is 100% volunteer. We do get reimbursed for our travel expenses, but we don't get salaries of any sort. So this is us donating thousands and thousands of dollars of individual time and lost income to the field, with the satisfaction of helping the field, but that's it. And so we're really asking for everybody to invest in this, because we're investing our own dollars, and we're hoping that everybody will see the value of that same level of commitment. We put together an article on acupuncture's role in solving the opioid epidemic that's been a really helpful document in terms of moving the conversation about acupuncture and its role in this epidemic forward, and can be used as a reference source for those needing that. We have worked to respond in a timely fashion to numerous calls for commentary, including commentary on the US HR 6 legislation. That's the first time that acupuncture has appeared in a legislative document of this level. We provided an informational document on that. That and other documents are available on our website. This is also an example of some of the work that our Public Education Committee, headed by Linda Camardella, has put together, including handouts that you can print out and have in your clinics, use in your schools, give to other medical professionals, little video vignettes talking about acupuncture, and other information to help promote the field, and just making that available as as a service to the profession. We've been really, really meticulous about documenting our activity and our achievements as well, we hope. And so you can always look at all the monthly reviews coming out on the website, as well as our annual reviews and our meeting reviews. If you have any questions about the work that we're doing, we have made that available to you 24 hours a day on the website. So please do take a look at that and really study those documents and get a look at what we've been doing. We don't feel like there's any question about the value of the work, but we definitely want to make sure everybody's getting a chance to review that. We've put out calls for commentary to the Center for Medicaid Services, the FDA, the Department of Health and Human Services, and other agencies who have asked for information on things like acupuncture's role in low back pain, and we did collaborate with NCCOM on quite a nice document, I have to say, submitted to them, which is also available on both our website and the NCCOM website. I think it's important for everybody to understand that the conversation around Medicare has really changed in the past year to 2 years. It used to be that our organization, was internally debating whether or not we wanted to engage in Medicare or not, and we really didn't take any meaningful action in that because people were split on it. Meanwhile, other individuals, medical doctors, the military, have shown that they want acupuncture. And so it appears that acupuncture is likely to be included in Medicare, whether our profession wants that or not. We have become irrelevant to that discussion. And the real question becomes, will licensed acupuncturists be included in Medicare? Because currently we are not Medicare providers. So we need to move forward legislation to make us Medicare providers, or hospitals, which are now looking to incorporate acupuncture as one of the main tools that they have in non-pharmacologic treatment of pain to avoid opioid use, will have to choose providers who are Medicare providers, and that will be doctors and nurses and PTs and whoever else can be trained to provide that service. So we would like to be sure that licensed acupuncturists are among the professionals who are up to be chosen and employed to be working in hospitals and other health systems providing this care. It begs the point as well, too, that the stronger we are, the better we're able to lobby for meaningful reimbursement. Medicare is a bit of a beast and definitely a double-edged sword, and having strong representation at the table is really critical in order to make that something that is a blessing to the profession and the American public, hopefully, and not simply sort of a rabbit hole. So that is a work in progress, but we need to be on top of that because that playing field is changing with or without us. We also, back in 2017, held the first ever Hill Day, where we went to Capitol Hill and we gave acupuncture treatments to legislative staff and anybody present. And it was incredibly well received, and we're going to be doing a similar event on June 3rd coming up as well. But it was a great way to educate legislators on acupuncture and what it has to offer for the American public. We've been working hard as well to maintain and evolve our journal. And so the journal Meridians is now the Journal of the American Society of Acupuncturists, rather evidently mimicking another major journal in the American medical healthcare landscape. We are hoping to get this journal indexed on Medline, which would really be an amazing boon to the profession. It would be the only journal really for licensed acupuncturists that's a Medline index that would be a publication opportunity for professionals and students. But again, this costs money to do. This is expensive. It is a full-time task. And so we need support to help move that forward. But part of being a real profession is having an actual independent, journal run by your medical associations, and where people can publish their information to their peers and to be seen outside of the immediate profession as well. We have also invested in legislative software that allows us to see whatever legislation is going around the country that's relevant to us, and some of this you can access from our website. That was another investment that we made on the part of the profession. And we are also developing a student section that we're going to be launching at our meeting coming up at the end of the month again. So we have our annual meeting June 1st, 2nd, and 3rd, and we'll be having our first meeting of the student section on June 2nd. So we hope your students will be there and that you will sponsor a couple of students to go and help them be a part of becoming the future of the profession, because we really need them to get trained in lobbying and legislation and what the real playing field looks like for our profession. I think we spend a lot of time internally discussing, and we lose track of what other people see our role being in the American healthcare landscape. And it's time for us also to listen as a profession and get that learning done. But we need these young folks to come in and take over for us so that they can do some of the work that we're doing now. We've also invested in a web infrastructure that our member associations can invest in that will provide them better web services at a lower cost than they can get now. It will also provide an integrated membership platform that will allow them to manage their own membership data, but also give the National Association real-time counts as to how many members we have and their status. We're also helping to develop individual state websites to allow for things like an RSS feed that comes from the national level and can provide ongoing and real-time news flashes that can be just put in through a single entry and shared across the country. And we're hoping to have individual websites purchasable for practitioners as well, looking to build their web presence, and who can optionally opt in also for that RSS feed. And that project is well underway, and we should be launching aspects of that later this year. So we're excited to see that infrastructure development for the profession as well. We have secured a number of benefits, including discounts on malpractice insurance, as well as at this meeting we'll be announcing the availability of life insurance, disability insurance, and slip and slide insurance type insurance for the profession at a discount to state association members. So as we get bigger as a group and as we are better organized and have good, structure, we're able to lobby for benefits that we haven't been able to get before as a professional association. So we're really excited for those. Most of all, though, I want you to make sure you're aware of our national meeting that's coming up June 1st, 2nd, and 3rd in Washington, D.C. And this meeting is going to be phenomenal. We have great speakers coming. They're going to be talking to us about not just integrative medicine, for example, but what is our role in integrative medicine? We're going to be looking at how to reach underserved communities. How do we engage with military structures like the DoD and the VA? What do we need to be doing better? What do we need to know in order to really be included? We're going to be looking at insurance models. We're going to be looking at research models. How do you do NIH grant funding correctly? Things like that. And so it's an incredible opportunity for us to evolve as professionals and as a profession. And then that will be followed by a day on the Hill where we'll be doing lobbying. And we have a training session for that on Sunday as well. So we have 15.5 CEU used through NCCOM approved for this. And it's just going to be a fantastic event, and we can't encourage you enough to come, because having everybody together really will make this an event to go down, we hope, in the profession's history. We're really excited for that. So please go to our website and register. The hotel room block expires May 9th, which is pretty much maybe the day you're watching this or shortly thereafter. And so please register right away for those hotel rooms, because that block expires again on Thursday, May 9th. So in short, we've really tried to put together an organization that can be a sound foundation and platform for the profession to do its work. One that can stand proudly beside all of the other major national medical associations and can effectively represent us in a transparent and well-governed and sound manner that hopefully everybody feels good about. And so we're hoping you'll join us in that support and become a part of the organization. And if you do have any questions, please don't hesitate to reach out to me. Misty can get me right away. You're welcome to contact me right away. Phone, email, again, we're available to you here to answer questions. So thank you, and have an amazing meeting, and I really appreciate your time. Thanks.